Thank you very much. It's a great pleasure to be here. It's a real honor. And the debate about second opinion is a debate that I think is a good one to have. May I invite the panelists onto the stage. Dr. Armani Ranjana from Stanford, Professor of Hematology and Oncology, Medical Oncology. Dr. Pramesh, who is the Director of the Tara Memorial Hospital and the thoracic surgeon. Ms. Shitapa Biswas, who is the co-founder and the chief exec of Cancer Foundation India, and last but not least, a dear friend, Dr. Tapan Saikia, who is the head of medical oncology and research director at the Prince Ali Khan Hospital. So I'll start by asking for a show of hands in the audience. How many of you think that a second opinion is really important following a diagnosis of cancer? Just let's have a show of hands. That's the overwhelming majority. Thank you. So, the panelists on the right are for the motion and the panelists on the left are against. And I think I'm going to do something different here because you are so for the motion. I'm going to ask Shitapa to open the debate. And we'll follow that with Ranjana. And based on what's been said, Tapan, if you'd like to come back, and we'll hear from Dr. Pramesh at the very end. And then we'll take a show of hands again, so it's up to them to convince you that a second opinion may not be necessary. Yes, please. So 5 minutes for each speaker, 3 bullet points. Shitapa.
To start with, I'll just say that, when Vandanaji says something, you can't say no. I think we are the ones who should be leading the hall, since everybody is for it. Everybody is entitled to opinion. It's a personal choice, as many as you want, not just second, third, fourth, fifth, sixth, it's fine. Depends on what you're taking an opinion on and who you are taking it from. That's, I think, the most important question. So once we take an opinion on, say, I'm not from Bombay, so what happens is that you go from point A to point B. When I ask someone that, how do I reach or where is it? Everybody counts in what time of the day are you going to travel? And there is going to be, stretching at different times. So that's an opinion. Everyone gives, sometimes it's right, sometimes it's wrong. And then of course is who you take it from. Many a times we take it from Google. So if you've taken anything on ever, I don't know if anyone has done that. If you take it for headache, by the time you're done with the search, you have a brain tumor, stage 4, and you're panicking because you know everything about it. So that's very important to know what you're taking it on and who you're taking it from. And then comes the point of when you're talking of cancer, it's something very, very serious. And we do not know things about it. So it's very important that you take an opinion, of course, on who is going to be your treating physician. Because it's a long journey. It's not that you go one day, you get yourself treated and you're done. It is a long journey. It is a relationship that you build with the person. Both the patient and the doctor has a relationship of a long-term journey of treatment, of cure, of follow-up. So I think what is very, very important is that you take multiple opinions of who the person is, but once you decide on the person, you do not take too many opinions. That I think most of you who have gone through the treatment of cancer, we have also had it in the family, we have realized that, it is not very easy to judge what is being said because no two patients are the same. There is nothing which is, one set or one size that fits all. So it's very important that each one is treated as a different entity. So when any physician takes up a patient, they have to put in a lot of their brain, of course, and heart in it to go through the whole process. It is not just one report that you take and you start the treatment. It's multiple reports. One needs to see the stage, needs to see the condition. And it's not just physical condition I'm talking of, also the mental condition. It's very important that the person is taken care of holistically. So whenever we are doing any such thing, I think it's very, very important for each one to understand that only the doctor understands the protocol. And we need to give in to whatever the person, the clinician or the physician decides. if there are patients here, they would know that it is not just in India, it's not just a patient who's getting treated, it's a family also. So it is one, the patient of course, most of the time they don't take much decisions. It is a main carer or a number of them, and many a times in the family, people start giving opinions even if they're not asked. So that again adds to the confusion. That, okay, so-and-so is getting treated in Bombay or somewhere else, and everybody has an opinion because they keep on hearing, because they are also using Google. So you can understand that everybody is well informed, right? Nowadays, so it adds to the confusion. So everyone says, I think this is not the right thing being done. I have known of some ex who was treated like this. Now the person who's the carer goes under stress because, he thought or she thought they're doing the best thing for the patient. Because most of the time the patient at that point, as I said, cannot take decision, and they're not supposed to. In an Indian family, most of the time, it is the family or the friends who take a decision for them. And again, for many, it's the financial decision also. It is not just the medication. When it comes to the finances, it is the family which puts in the finances most of the time again. So it is not just what is being given. Is it affordable? Is it possible for the family to take that medicine? So many a times it's the physician who decides that, okay, let us have this combination or that combination, ensuring that the patient recovers. At the end of the day, everybody is working towards that. So any opinion that is given, as I said, second, third, fourth, fifth, always does not help. So I think everybody should take an opinion in selecting the right physician, but once they've done it, I don't think it really helps much to keep on changing and finding the second, third and fourth person, because that delays the treatment process and doesn't really help in the long run. Because as I said, after you've been cured, you still have follow-up to go back to, and that physician has to remember you. They have a lot of patients, they still have to remember you and think that, okay, it is X and I have to take care of him or her this way. So I guess that's what, and it depends on where we see the show of hands after a point of time. Thank you.
Thank you very much, Deepika. So the message, I think, is take opinions, as many as you need to and want to, until you found the right physician and stay with the right physician or surgeon. Dr. Anjana.
So I'm not sure whether you were arguing for or against. Anyway, so the 3 points I wanted to make is, one, doctor-patient relationship is based on trust. You are sort of trusting your caregiver or physician to make your basically life-changing choices. Now, even when you're going to buy a car, you don't just go to the first shop and buy your car. I mean, you do research, you look about how well it's going to run, what it's going to be, what the experience has been. So for anything you buy which is valuable, you do check things around before you say, okay, I'm just going to walk into the first store. So here, this is your most precious asset you're ever going to have, is your life. And that life you're putting in somebody's hand. And as medical knowledge changes pretty rapidly, a doctor's experience in complex cases, it's not one sleeve fits all. And it's hard for one particular person to keep up with everything. And especially in India, where the practice of medicine is more like everybody seems to do everything. I mean, Tata is different where they subspecialize, but in general what I've seen is most people in private practice treat all kinds of cancers, that it's hard to be an expert in everything. And when you're putting your life, which is your most precious asset in somebody's hand, I think you do need to go for second opinion to figure out what is being told to you. You get better educated about your disease. When you're better educated about your illness, you are then poised to, you're capable of asking more educated questions, which you may not have thought about the first time. You're in a state of shock when you get the diagnosis. And when you see a doctor, you may not have asked half the questions which come to mind much later on. And typically you're scared to sort of go back and ask because they say you're going to start treatment. When you go for that second opinion, it's reassuring that you are hearing the same thing. So, whether your diagnosis or whether it's your treatment plan, you heard it twice, so then it's settling in your mind. Okay, everything I heard is right and I'm going to feel confident and go forward. On the other hand, you're also going into it a little bit more educated and have had the time to think about it and ask a few more questions. And I think lastly, it really helps to see who you're more comfortable with. It is not even siblings don't get along. And this is the rest of your life, you're going to sort of have this long-term relationship. And everybody approaches things differently. You may get along, you may feel you communicate better with one physician versus the other. Who is more open to listening to you? Who are you able to ask more questions freely? Or who is answering them? I think you get a judge of who you're going to be dealing with and partnering with. It helps you form a better partnership and get better care. The more educated you are, and if nothing else, it reassures you that everything was told to you was fine, and you go into it with a much more confident plan with whoever you choose at the end.
Thank you very much. Dr. Tapan, let's hear from you.
Thanks, Adam. And thanks all of you for coming here. Will there be some scores here? Are you going to get some scores? No? Yes. Show of hands. So, okay. First, I offer my immense respect to all members of WeCare. There are Mrs. Vandana Gupta. There are people who do selfless services, and there are people who do selfless services. Each one brings in happiness and joy to society. And I'm proud to be part of the WeCare. Thank you. And I don't really wish you to go away with the wrong ideas, debates after enriching our knowledge. I found them uncomfortable when I was school days when my friends made fun of the topic. So I remained faithful to gel knowledge quiz. And that really helped me in my later years. But today is a debate. I'm not calling it a debate, I'm calling it challenges of second opinion in oncology. Let's call it that way, challenge. And Promise coming after me. And Promise know what's coming now. So cancer is a complex disease. An opinion needs deep analysis and time. Second opinions take the longer sittings, while the primary oncologist has 3 to 4 more visits to take history, examine all the tests cautiously, and do some homework. But often second opinions are extra work for the person when somebody goes to him or her. However, many physicians take enough time to offer opinions, primary or secondary opinions. Let's accept it, if not all. First and foremost, respect opinion of the first physicians. That should be the job of the second opinion. Actually, if you do that, it works wonders. So let's check first. What's a second opinion? Where the primary one has offered treatment. So is that a second opinion? Because some people might do a half investigation, then go to another person. That's not really a second opinion. That's probably a half-done job. The second opinion is the first physician, oncologist has walked up and decided this will be your line of treatment. Then you decide that let me go to another person, then another person. That's second opinion, or third or fourth. Looking at the reports and offering suitor facility and offering a final opinion is fraught with danger. Inadequate information, a lot might have changed in the patient's health by the time the other physicians gets to read the reports. Maybe days or weeks or months. In oncology, the prognosis depends entirely on the performance status. We have been trained not to offer chemotherapy for patients with a very poor performance status. A surgical or radiation therapy option can only differ widely. So what do you do? Trust one? Of course, certainly in God we trust. Not seeing a patient offering a specific treatment is, well, sending out an international guideline, as many second opinions do, all over the world. You send something well, get $2,000 to one of the institutes in the US, or 600 rupees in India, you get an international guideline. Everything is given there. You get more confused with that. That does happen. So there is a clear documentation that opinions without seeing a patient could be wrong often. Where does the patient go after the second opinion? Suppose the local oncologist, the lone one around the 100-mile radius, has offered the best possible treatment and second opinion was exactly same. But the patient did not show initial trust in the primary oncologist. What do you do? The patient with the cancer lives long, as Sutapa said. How long would he or she travel to the distant center for treatment and follow up again and again? Now, he or she would be at the mercy of the primary physician, and his behavior might not be a desired one at this moment of time. And it does happen every day, we all know that. Where does one go if the primary oncologist refuses to give a referral note? That also is true. As a primary physician, sometimes we refuse to give. So you go and take one option. But we fail to write down on the paper that please take a second opinion from so and so, or anybody you choose. That's where the problem is. Not saying second opinions are not good, but for second opinions, the primary oncologist has the job, and the secondary oncologist also has the job to do. Thank you.
Thank you very much. Thank you. Dr. Kamesh.
I think they've done such a bad job at arguing their case that I'm going to argue for them. I don't think second opinions are required. Yes, I don't think second opinions are required, provided medicine was black and white, treatment decisions were actually made on hard data, guidelines were followed universally, regulations were in place to ensure that guidelines were being followed, and if they were not followed, there are metrics to evaluate the performance of a physician or an institution, and if multidisciplinary care and site-specific expertise was available. So let's look at each of these points. The first about medicine being a black and white science. Though you would look at confidence as an asset in a physician, it's sobering to know that less than 50% of what a doctor actually tells a patient, or the way a diagnosis is made or a treatment is made, is based on hard evidence. So 50% of the time you're just depending on previous experience or something which is not actually hard data. Let's look at the next aspect of whether regulations are in place, or even before that, whether guidelines are in place. Till about 2 or 3 years back, the whole of the country did not have a national consensus guidelines for treatment of cancer. This might come as a surprise because in several other countries like the US and the UK, the guidelines have been in place for decades. It's not that guidelines weren't in place, it's just that the guidelines were so complicated, elaborate, that no one actually followed them. And even those guidelines which do exist are not enforced because there is absolutely no regulatory mechanism in place. Or reimbursements are not based on whether you follow evidence, whether you follow the guidelines. It can be anything that a doctor feels that can be right. And you know that there are various factors which come into play when a doctor gives a diagnosis or a treatment decision. We'll come back to this issue of what quality cancer care is about. There are 3 principles which are important. There's enough data to show that if a group of experts sat together, even within a single institution, to decide on a treatment plan, the outcomes of the patients is much better. This is the concept of multidisciplinary care. So if I as a surgeon see a patient with lung cancer at the Tata Memorial, I cannot make a decision on surgery on my own. It's a combined decision made in the presence of the medical oncologist, with the presence of the radiation oncologist, the pathologist and the radiologist. And there's clear data to show that such a multidisciplinary approach improves outcomes for patients. I'll give an example. This was a hypothetical study which was done in the US. A particular case with prostate cancer was circulated, a hypothetical case of prostate cancer was circulated to over 200 oncologists. Some of them are medical oncologists, some of them are radiation oncologists, and some of them are urologists. Urologists are surgeons who treat prostate cancer. 80% of the surgeons for that particular case scenario suggested surgery. 80% of the radiation oncologists for the same case suggested radiation therapy. And most medical oncologists hedged in between surgery and radiation because fortunately localized prostate cancer is one disease where there is not much role for chemotherapy. So this in an advanced developed country where there are regulations, where there are evidence-based guidelines to treat them. Imagine a country like India where there are no regulations, nor are there standard guidelines to treat them. The next point is site-specific expertise. So at the Tata Memorial, we are fortunate that we have a large cohort of physicians. So we specialize in individual cancers. So I don't treat anything other than thoracic cancers. Somebody else doesn't treat anything other than colorectal cancers and so on. But this is a huge minority in India's medical world. So it's less than 10% of institutions have this kind of site-specific expertise. So just imagine somebody who's treating leukemia one day, colorectal cancer the other day, lung cancer the next day, the breast cancer the next day. And with the way science is progressing, to expect that individual to be an expert in each of these cancers is being naive. Maybe this could have survived 20 years back, not anymore with the kind of advances that we see in medical science. So out of the 1 million patients that have cancer on an annual basis in India, less than 100,000 of them, less than 10% of these patients have access to site-specific care or multidisciplinary care. So where does this concept of going by the first opinion you take and taking your treatment based on that apply? We all know that the first shot at treating a patient with cancer is probably the single most important point which decides the patient's outcome. The wrong decision taken at that point will actually result in very variable outcomes. So the arguments for not taking a second opinion are often that of cost and time. The average cancer before it's detected in India is at least 6 months to 12 months before the patient actually presents to a doctor. What is the time wasted by an additional week or two in seeking a good second opinion and actually deciding the fate of your treatment and possibly your entire outcome based on that? We also consider that the cost of getting a second opinion is what is a deterrent. Again, most cancer treatment now runs into hundreds and thousands of rupees, and it's actually, especially when you come to advanced disease, it's much, much more. What is the cost of a second opinion, which often costs a fraction of that? Again, very small interventions, getting a second opinion is something that's clearly a game changer as far as getting the right treatment is concerned. I know we start off with a disadvantage because most of you already felt that a second opinion was required, and to convert the naysayers to the yes-sayers is probably a more difficult job than what they had. But I'm hoping that with these arguments you will get convinced that a second opinion is probably the best thing that a patient can take, especially in a situation like India. Thank you.
Thank you. Before I take a show of hands again, I do want to ask both of you, how do patients know whom to go to? And where does the second opinion stop, as in third, fourth, fifth, sixth?
So, obviously you have to do some homework, and it depends on an Indian situation. The family plays a huge role too. So you may go, it also depends on the urgency of the situation. If somebody is very critically ill and you're in a hospital and you have to start treatment immediately, I don't think you have the luxury of time in that situation to go for a second opinion. You just have to put your trust in who you are. I think we're referring to scenarios where people are stable, where they can't go for a second. And then I don't think it takes weeks and months and 6 months. It's pretty, within a couple of weeks you can get a couple of opinions and you're done. The issue is if two people tell you two different things, that's when you go for a third opinion. But if you go to two and they tell you the same thing, then it's basically, you know that you're on the right track. Most people have read up a little bit, or if the family has said something, or they've asked their friends, one way or the other, even if they haven't done any of that homework, if two people tell you the same thing, yes, this is the right thing to do, you know you're on the right track. And you just go into it more confidently. If two doctors tell you something completely different, then go get a third opinion. You need a tiebreaker.
Do you have anything to add to that? And I'm going to give you the last word. Do you have anything to say in response to that?
Well, as physicians, we have been giving second opinion day in, day out. Ranjana and I were talking before coming up to the dais. Say that the right hand needs to know what the left one is doing, left hand one is doing. That's not happening in India. One oncologist or one physician or one surgeon refuses to talk to another. That's where the problem lies. I think there's no one solution. We all need to be aware that we talk to each other. We make sure that the primary physician, secondary physician, they talk to each other. But I want to end with something. Always something in Urdu or Hindi. Because enough of debate. All right. दिल ढूंढता रहा एक खुशबू की ज़राए, दिल ढूंढता रहा एक खुशबू की ज़राए, यहाँ भटका वहाँ भटका पर कहीं ना मिला, आखिर एक दिन अपनी बदन से ही वो निकला. This is Kasturi Murthy.
Thank you. On that note, let me get a final show of hands in favor of a second opinion, please. Well, thank you all very much. Thank you. Thank you to VK Foundation for this debate. Thank you.
May I please request our panelists and the moderator please be on stage. We wish to present a token of appreciation from VK's side. Thank you so much for taking our precious time and coming and enlightening us about this concept of taking a second opinion or not taking a second opinion.
Madam.